Okay, if you're wondering what a nationally renowned pediatric infectious disease expert and vaccine expert has to say about coronavirus and how you should approach it for your family, this is the video for you. Okay guys, I am super excited today because I get to talk with a pediatric hero, legend of mine, Dr. Paul Offit. He has an impressive resume, which you can Google and see everything that he's done. He's written a ton of books. He's a pediatrician, a pediatric infectious disease specialist, a vaccine developer. The reason that your child gets rotavirus vaccine is in part or in large part due to Dr. Paul Offit here, who I'm talking with today. And he's written a lot of books about complementary and alternative medicine, which I love to read and share with patients when they ask me questions. He's written about celebrity advice and the bad advice that celebrities give and why we choose to take that over our doctor's advice. He's had a long career of helping children, protecting children, and helping the public. And so I'm super honored and excited to get to talk with you today, Dr. Offit. And I was thinking we could talk about coronavirus because it's kind of been making the news a little bit this week. And my audience would love to hear any updates that you have on coronavirus. And in particular, we're seeing all this on the news. What's a parent to do when they see all of this information coming at them on the news? Like what can we do? How can we protect our families best?
All right, so let me start from the beginning. Coronaviruses were first identified in the 1960s. Since that identification, we know that there are 4 human coronaviruses that circulate every year in the United States.
Okay.
In our hospital, we'll see about 15% or so, or 20% of the children who come into our hospital with respiratory disease will be infected with one of those 4 strains of coronavirus. Now, recently, in the last few years, there are 3 novel coronaviruses that have emerged. By novel, what I mean is that they're brand new, therefore there's no population immunity. Therefore, they can spread from country to country and cause a worldwide epidemic or pandemic. The first was called SARS, systemic acute respiratory syndrome, accounted for about 8,000 cases and 800 deaths. In this country, there were fewer than 10 cases and no deaths.
Gotcha.
The second was MERS, which came out of the Middle East, hence Middle East Respiratory Syndrome. That accounted for about 2,500 cases and 1,000 deaths. Again, fewer than 10 cases in this country and no deaths. Okay. Now, the third coronavirus, which is largely a bat coronavirus. I mean, the sequence shows that it's about 96% bat coronavirus because many mammals have their own coronaviruses. This virus is different than the first 2. This virus has the capacity to spread. This virus is more like flu. So where the first 2 viruses, if you got infected with SARS or MERS, you were sick, very sick. So it was very easy to tell who was sick and who wasn't. Very easy then to quarantine them, put a moat around them in a sense, and quell the fire. And that's why we never had a problem in this country. When those viruses came in. This is different. This is spread from person to person, in many ways much like flu. It has the symptomology of flu, congestion, cough, runny nose, occasionally lung infection, occasionally severe lung infection. It has the transmissibility that seems to be similar to flu, which is to say the so-called reproducibility index of 2, which is to say I will infect 2 people during my normal day, they'll infect 2 more, 2 more, 2 more. So it's not like measles has a reproducibility index of like 18. And then the question becomes, does it have a mortality rate that's higher than flu? Now, the mortality rate of flu is listed anywhere between 0.1 and 0.5%. Here, the mortality rate, according to the World Health Organization, is around 3.5%. If you look at the data from China, they'll argue it's 3%. The problem with mortality rates is nobody really knows the denominator. I think you know who's dying of infection, but I don't think you know really who are asymptomatically infected or mildly symptomatically infected because they don't come to clinical attention. So why are people so panicked about this virus? Or said another way, why is the media so panicked about this virus? Excuse me. I think that the reason is people assume it's more virulent, and they're confusing contagiousness with virulence. Yes,
that's a good point.
It's highly contagious here because there's no population immunity. No one's seen this virus before, therefore it can spread quickly. But that's different than being virulent, and I don't meaning capable of causing death. And I think until all these testing kits are out there, we're going to have. It's only then that we'll have a better idea just how contagious this, or how fatal, how mortal this virus is.
Right. Once we're able to see how many people have it and get a better estimation then of how many are dying or having severe illness, then we'll have a better idea of the virulence, rather than just what I hear you saying is that right now it's kind of biased towards those that are sicker because they're the ones that are getting tested and they're the ones that are dying because they got tested and it's because they had severe illness. So it's there's a bias towards illness. And then if we could actually test more people for it, we would dilute out that and we would see a true estimation of what the mortality rate is.
And that's what happened in 2009. I mean, when H1N1,
Okay.
so-called
Right.
2009 swine flu strain, came into the U.S. in 2009, look at the original mortality rates that were listed as like as high as 10%. When it was finally all said and done, it was less than 1% and probably actually less than 0.1%. So if you take a lesson from that, as you learn more and more about the virus and its spread and its real mortality rate, then that comes down. Because see, what upsets me in this is that I think what you should do is you should do what we always do every winter when there is spread of respiratory syncytial virus, parainfluenza virus, coronavirus, normal coronaviruses, is just do common sense things, which is say stay home if you're sick. I mean, if you have mild disease, try not to spread it to other people, which is to say touching your eyes and nose and mouth and shaking people's hands. I mean, and try and stay away from people who are clearly coughing and sneezing because that's really how you're going to get it. And you need fairly close contact. You really need to be within about 5 feet of somebody to get it. It's not like measles where you just need to be in their airspace. So just do that anyway. But that we're closing schools or that we're canceling meetings doesn't make a bit of sense to me. I mean, let me put it in this perspective for you. Since January 1st, 20 children in the United States have died of influenza. 20 have died of influenza. During that period of time, 11 total people in the United States have died of COVID-19. So why is it that we're so scared of this virus but not scared of flu, which is much more likely to kill you? There's no way that the COVID-19 is going to catch up to the number of flu deaths in this country, which we already have, according to the CDC, an estimated 18,000 to 46,000 deaths from flu. Even if this virus caused 1,000 deaths a week, it's not going to catch up to flu. And remember that first of all, it's not going to cause 1,000 deaths a week. And secondly, I think if it does 1/10 of the devastation of what flu does, I'd be surprised. And as a general rule, it's true with other coronaviruses, these are winter, spring diseases. This is not likely to spread into summer. So it come in late. Therefore, it didn't really have a head start.
It didn't have the whole November through March, April time.
Exactly.
Right. And so what I'm hearing you say is, even though it's all over the news, that in reality, like, we're not closing schools, we're not stocking up on toilet paper because of influenza season. We're going about our normal business and normal church and going to Target and Walmart and daycare and school and everything like that. Despite influenza being much more virulent, we should try and take the same approach with our habits, with closing schools, with the panic and hysteria with coronavirus. Am I hearing that correct?
Yes, and so when Mike Pence, for example, says that you should talk to your doctor about getting a COVID-19 test, I think that's not a good idea. I mean, what worries me in all this, we really can do harm. So how does the fear cause harm? I think the way it causes harm is that you overwhelm the healthcare system. Now we have hundreds of people coming to our emergency department waiting to get tested for their mild upper respiratory tract infections to see whether it's COVID-19. Thus, taking up a lot of resources, pushing to the side people who really do require medical care, and now who are going to have a harder time getting it because we've overwhelmed the healthcare system with this. I just think that we've created this false notion of how virulent this is. I mean, when Mike Pence, for example, praised for the man who died in Washington State there in that national broadcast, why wasn't he praying for the 10,000 people at that point who died of influenza? What's the difference?
That is certainly a good point, that we have just become accustomed and used to influenza, and it's not scary because it's not from a foreign land and it's not something that nobody's seen before. And so we're complacent about influenza, and it's hard to get people to get flu vaccines, but everybody wants the COVID-19 vaccine yesterday, and they want the test and then some treatment for it. What do you think that if you're talking with a family that has young children, it sounds like the message is do exactly as you normally are doing. Go about your daily business, wash your hands, which is just plain good advice anyways. But don't let it affect your family. Don't let it monopolize your time and attention and take away from, enjoying life in 2020 as a family and enjoying the time with your kids because you're so paralyzed by fear over a respiratory virus that will likely play out not being as bad as this yearly annual flu that we have.
Yes, exactly right.
Okay. Can you talk a little bit about the idea of a vaccine for coronavirus? I know that there's been lots of talk on that, and I know it's a ways off before. Is that something that is a high priority, or what does that process look like, I guess?
Right. Certainly, to my knowledge, at the FDA yesterday, because we were picking the strains for next year's flu vaccine, and I asked the person who's in charge of their viral regulatory unit whether they received any applications yet for that to review a vaccine product. No was the answer to that question.
Okay.
But my guess is there are a variety of different approaches which will be used here. I think that there will be so-called RNA and DNA approach where you sort of have naked RNA or naked DNA which gets taken up into the body and then transcribed and translated to become a protein. That single protein would be the protein that sits on the surface of the virus, so-called glycoprotein. Sanofi was making a SARS vaccine. The way they were making it was to a so-called recombinant DNA technology, which is they have a baculovirus vector into which they clone the gene that coded for that surface protein, which then gets taken up into insect cells, specifically butterfly cells, and that protein then is made as a single protein. So it's like the hepatitis B vaccine, which is a single protein vaccine, or the human papillomavirus vaccine, which is a single protein vaccine. Those vaccines generally need to be adjuvanted. The single protein vaccines generally need to be adjuvanted. So the question then is which adjuvant and which adjuvants. So you would have to, once constructed, you would then have to decide, do I need an adjuvant, and if so, which adjuvant? You then would need to do extensive animal model testing to make sure that it was immunogenic and safe in animals, and then you would need to do phase 1 and phase 2 testing in people to see whether it was safe, which is critical, and to see whether it's immunogenic, meaning that it induces an immune response that would likely be protected. Then and only then would you be ready to do so-called phase 3 trials to see whether or not it's effective in people. That would take at least a year, and I think the more likely 18 months. So this is not something we're talking about for this current epidemic, assuming it ends in the summer. This is something we're talking about should it come back next year. Remembering neither SARS nor MERS came back the following year. And if this virus does spread the U.S., there'll be a lot of population immunity, making it more difficult for this virus to spread because I think immunity would last for years. So we'll see how this plays out. I think where people got confused was with Ebola. I mean, when Ebola outbreak hit West Africa, we had a vaccine that was readily available. So people thought, great. I mean, how hard is this, right? I mean, here's the vaccine. The thing that people didn't realize is that vaccine had been in the work for 20 years. They'd already phase 1 and phase 2 testing. So
there's already been Ebola. This is a brand new thing. So you're telling me I don't need to call my local pharmacy to see if they have the coronavirus vaccine in yet. And
you can. They're going to say no.
They're going to say no. What do you think we'll see in the coming weeks in terms of our country and the response from the local health departments, national health, the FDA, everyone, the CDC? What's that going to look like over the next few months? Is it just too early to say how things are going to unravel and we kind of just have to sit and wait, or are there good indications of how things will go?
So let's assume that the virus is clearly spreading from one person to another in this country. We know that. We have a good idea of the reproducibility index I of 2, which is to say you'll infect 2 people during your day. So the virus is spreading. We have now 11 deaths. You're not seeing hundreds or thousands of deaths. As the virus spreads more and more, you'll have a much better idea of what the mortality rate is, I think, because you can assume it's spreading from person to person. It's popping one state after another. It's spreading. So now we'll learn about the mortality rate. I would be surprised if this mortality rate was 1/10 of flu's mortality rate for a number of reasons. One is because it got a late start. Was one of the and I don't think it'll be any more. I just don't think it's going to be any more virulent than flu. So for those reasons, I think we're not going to see an enormous amount of damage in this country. I think the damage that will come from this virus will be that there will be limited resources from healthcare systems because those healthcare systems have been overwhelmed by the fear of the virus more than the virus itself.
Well, I mean, we've definitely experienced that fear and how that's affected our practice. One, because we get a lot of phone calls, of course, from worried parents that just kind of want to know what to do, which is why we're creating this content that we can share with families to try and help. And then two is, it's hard to get medical supplies for our own office now, masks and gowns and those sorts of things, because there's just no stockpiles left because they've been exhausted by practices in hospitals and personal people, protecting themselves or thinking they're going to protect themselves. Do you think that, like, if you're getting on an airplane today, are you wearing a mask?
No, nor does the
No.
CDC recommend it. Those surgical masks, those rectangular surgical masks, if you watch when people with them on, obviously you can breathe around the side of those masks. So you can breathe out and you can breathe in other, they don't work. I mean, so that's why the CDC doesn't recommend it. As you know, you could wear an N95 respirator, which tightly fits around your nose and mouth. But most people don't have them. It's certainly not recommended. They're not all that easy to breathe in either. They're uncomfortable to wear for a long period of time. I just think, we have another winter respiratory virus, COVID-19, to go along with the influenza, respiratory syncytial virus, other coronaviruses that are out there, all of which are also going to be causing disease, all of which also have the possibility of causing hospitalization and death. This is now another one. What makes this one different is there's no population immunity. So it's going to far more than will these other viruses that I just mentioned. But I don't think it's likely to be more fatal. And also, you should take heart in the fact that, as a pediatrician, that it doesn't appear to be fatal for children. Children aren't dying. I'm not sure why that is, which makes me nervous, because usually I'd feel better if I knew why that was true, but it doesn't seem
sure. It seems like, and we do, like you had said, you see a lot of non-COVID-19 coronaviruses in your hospital, and we get those, respiratory viral pathogen panels from the hospital from time to time, and we often see that, and then parents think, oh, they already had coronavirus, but it's sometimes it's difficult to understand. This is a new one. This is one that hasn't been in the population before. And so even if you've had those other ones, that's not the same nor the same disease course. But I'm glad to hear that you're saying it's okay to go about your normal life. You can still fly on an airplane without a mask. Those masks, the other thing that I know is when I have to wear a mask in the room sometimes, like I touch my face a lot, which just brings the germs to my respiratory tract much more easily. So I think another good reason to avoid the mask at all costs. Okay, let me ask you a question, because I know that you have an extensive history and publishing history in complementary and alternative medicines. So if we can do a rapid fire, which essential oil do I need to be protected from coronavirus?
That was a trick question, right?
Yes, I was just kidding with you. I thought maybe you said olive oil or something like that, drizzle on your broccoli or whatever. How about elderberry? What's the status on that? Because I know that there's been some back and forth on that one. Is that one helping? That one's one that I get asked a lot about, is elderberry syrup.
Well, the goal is to try and keep the virus from attaching to cells. Okay, if you want to prevent infection or treat infection, the goal is to keep viruses from attaching to cells. There's two ways that can happen. Either one, you have immunity because you've been exposed to this virus before, or you have immunity because you've been given a vaccine that has induced an immune response directed against the surface of the virus so that the virus can't attach to the cell. That's it. All these other sort of, oils and herbs and spices and metals and stuff can't do that. There's only two ways to get immunity. One is to be naturally infected, or two is to be vaccinated. That's the only way. It's specific immunity. Non-specific immunity doesn't work. Although you should be healthy. You should eat well and exercise. The degree to which you're unhealthy is the degree to which your immune response is not as good, but that's it.
So things like high-dose vitamin C or airborne or other things like that, those would also be things then that would fall into that category of not helpful in preventing COVID-19 or any other infection. Is that what I'm hearing?
I would put, anytime you take large quantities of antioxidants, remember that your body needs oxidation. Your body needs oxidation for things like killing bacteria, for killing new cancer cells. I think it's always dangerous to take large quantities of antioxidants. There's no value in that, only harm.
So wash your hands, eat your vegetables, avoid sick people, keep calm, carry on, is what I'm hearing from you.
Think of maybe the only good that will come out of this is that people will have a healthy respect for winter respiratory viruses, including influenza. For at least there's a vaccine for that, and practice good sort of respiratory hygiene in the winter months. Maybe that'll be the result in all this.
Okay. Well, it was such a pleasure to talk with you. This has been exceedingly helpful for me as a pediatrician, and I know my audience will really appreciate the update, the information, and the reassurance that things are going to be okay despite the news media coverage and what it's being touted as, that at the end of the day, this is another respiratory virus that we are used to. Get your flu vaccine, wash your hands, eat your veggies, avoid the hype, and avoid the hysteria.
Right. Thanks.
All right. Well, thank you so much for your time.
Sure. Sounds good. Good luck. Good luck there on the front lines.